जस्ट मोमेंट. हा आता आपलं नाव my picture is visible or need to make it more bigger one.
If you could make it more bigger because it's too small and in mobile you won't be visible.
Visible, yes, 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 make it more big. येऊन दे त्याच्यावरती, काय हरकत नाही. Now
Okay.
yes.
I'm starting the invitation one, opening the waiting room.
Yes, yes, please. मी काय म्हणतो होतो, त्यांचं ह्याने ते केल्यानंतर आता मला क्वेश्चन आन्सरच्या वेळेस ह्याची गरज नाही. हां, हे नाही दिसलं तरी चालतंय.
So good evening. It's 8. So Tanya is always right on time. So it's my great pleasure to invite. Recording in progress. Invite our guest speaker, Dr. Shailesh, again to our stage. And as he has discussed last time, one of the case and his insight, he is going to continue his conversation and he will explain deep into his thought process and he will let you know. He will first you let your doubts be cleared and he will do the session in a most wonderful way that you will be enjoying. So as the time is 8 and 1, so I'm just inviting, sir. We don't want to miss any minute of his conversation. So I'm inviting Dr. Shailesh, and I'm also making you a co-host as well, so that if you want to do anything like that, okay. So Dr. Shailesh, the stage is yours.
Yes, thank you, Dr. Libin. So good evening everybody. So before going to start our today's session, let's have discussion about the whatever the questions is being put it into last time, right? So here the questions are, the first question was like EBV, IgG and IgM. That one of the viewer asked this question, how we are looking into. See, the very important thing in modern science, what is IgG, which is called as a labeled as a past exposure, means, or they say that the infection got clear. And what is IgM? They says it's an active. What is important, measurable, then they are consider. Means they say that ki if it is an absence or if it is not detectable, they feel that virus is not there. Hello? Hello? My voice is audible?
Yeah, you are audible. You can continue.
Okay. So, but what is a clinical experience is how we interpret. See, what I truly matters is whether IgG or IgM positive at the given moment, but whether the virus ever entered into the host at any point in between birth and the till the diagnosis is more important. Like how I always say to my all students, if that virus got entered, that is why that IgG got positive, because IgM is a recent infection, IgG is a past infection. If the infection is entered, that is why that IgG is positive getting today, means it was a past infection, it is already shown. Whether it is not been shown into the viral load, because most of the time what we did is to measure the infection we check DNA PCR or RNA PCR, but there we get the viral load is absent, itself indicate that viral load is not there, but that host got infected somewhere from the birth till the diagnosis for that virus, and how it affect on the body, that is what we are going to talk today. Like how IgG is also important. Usually people says no, it's a old infection, but that's not true. Actually need to understand how it is. Now, if we look at about the being homeopath, what is our responsibilities beyond detection, what is measurable, we are trained to perceive the unseen, to recognize subtle disturbance of the vital force, and to treat the person as a whole. This approach aligns with the teaching of our master, who emphasizes specifically on that the true cure lies not on the suppressing the isolated finding, but in the restoring the internal harmony. Now, can eat fruits? My answer is for that question is yes, because most of the time what we found, usually patient says ki I get to know ki don't eat this food, don't eat that fruit, but why I say ki that is going to helpful, because fruit contain natural sugar, which is moreover fructose and glucose, where the fibers it contain which actually slows the sugar absorption, antioxidants and micronutrients they contain. That is why I usually say the goal is a glycemic control, not a complete avoidance. That's why the diabetic person can eat fruit, but how? They need to eat the whole fruit instead of juices. One serving at the time like 100 to 150 grams they can have. Usually when to have the fruits, because many time we have this discussion at what time is the suitable time, like a morning or evening snacks they can have the fruit, never with the main meal. Because why? Because it usually reduces postprandial spikes. Now, avoiding combining multiple fruit together, that is also very important. Even though pair with the protein fat if it is needed, like nuts and seeds, they can use into it. But hope you guys also face this question ki doctor, I need to avoid the fruit at night? Because oftenly we discuss the fruit should be taken in the morning or in the evening, but not at the night. But why the people ask this question? Because they have that ideal कि fruit should not be eaten at after 8 o'clock or after 7 o'clock. But what I know is कि there is fruit is a natural substance, human bodies are also natural. Fruit is a alkaline substance. Whenever the human being take a birth is also in the alkaline phase. Now the people eat like carbohydrate, sugar, fats, like ice cream, like beverages or fruit, or somebody take the coffee or Chinese item at night, but nowhere written it should not be eaten after 8 o'clock. But yes, the people do eat, and it is not written also you can eat. But what they understand from that perspective, it is not written means you can eat. That is their own observation or own side they are looking for. But what happens is this type of contains foods which what they do, they increase the gastric acid load, even the insulin spike and even the inflammatory markers. That is why, but in if we look at about the fruits, they contain natural sugar, no doubt about it. They contain organic acid, mineral like potassium, magnesium, antioxidant compound. Yet that effect generally alkaline after digestion. They have very low inflammatory burden when we compare up to the processed food. So therefore, the question is not about the timing. Question is about the consumption of fruit alone. But what happens is all about is digestive efficiency along with glycemic control, overall metabolic health in individual with the normal digestion along with insulin sensitivity. So consumption fruit in the evening does not inherently create a harm, but issue arise only when the digestion is compromised or when fruits are combined with the heavy slow digestive meal. So having fruit is not an issue. Now, one of the question was why to introduce coconut water in the patient's diet. Genuinely telling you, coconut water does not alter gene, but it improve the terrain in which genes survive, repair, express themselves. So, how coconut water is important, from that perspective, we need to understand. if we see the composition of coconut water, what it contains sodium, calcium, magnesium, even the phosphorus associated with the iron and copper. These play a role in the DNA maintenance and even though in the repair, either structural component of the DNA or molecule itself, even the cofactor for the repair enzymes or maintaining the cellular environment necessary for the genomic stability. So, this perspective, if we keep, there we get to know why coconut water is important. Now, another question was there, what does the sugar, carbohydrate, and gluten do in cancer? Answer is, because usually this question patients also ask us, doctor, does sugar or carbohydrate or gluten is affecting my cancer or it is helping cancer to progress or metabolic changes? But answer is basically yes, because high intake of refined carbohydrate sugar, what will happen if the person is going to take? It will support tumor growth, worsening the prognosis, particularly in insulin sensitizing cancer. Like which cancer? Breast cancer, colorectal cancer, even the prostatic, along with the pancreatic cancer. So they are supporting to grow. So that is why sugar, carbohydrate, gluten need to consider. Now cancer cell preferably utilize the glucose via aerobic glycolysis. What it says, it's called as a Warburg effect. That what it done, it promote invasion and metastasis, reduce immune surveillance. Gluten does not directly cause a cancer, but it has a susceptible individual. It may influence the prognosis via immune and inflammatory pathways. Now, what is the basic takeaway message from that all the stuff? Cancer prognosis is not determined by the sugar or gluten alone, but by the metabolic and inflammatory environmental they help to create. Like tumor thrive in insulin rich inflamed terrain and struggle metabolically stable immune competent host. So sugar and gluten need to restrict is really important. That is why I usually say to my all patient, I always tell to everybody what is to be eaten, you need to tell that patient. But don't say don't eat this, because nobody wants a restriction. Whether they are in a terrible phase, still also they feel I'll eat. Better say, have this fruit, have this salad, have the coconut water, eat before sunset, and chew food properly. And if you have food, walk regularly. It will help to maintain their physiology, even though it will help to boost a positive terrain into their body. Now, so let's start with the today's session, viral link to the cancer. Hope the whichever the question has been asked at the last session, I hope I have already answered that question. So let's proceed with the today's session. Dr. Libin, everything is okay now?
Yeah.
Great,
That's perfectly fine.
great. So now the point is, these are the two things what we are going to start. Before approaching a case, let's start with the 2 points. What is terrain and what is epigenetics? My dear doctors and respected colleagues, very important is what we are going to talk today. We are doing it regularly, and you will definitely say that yes doctor, you are saying is right, but we are not aware what we are doing is, and that other modern science says that is derived by them. No, it's derived by our own master. How? Let's start with it and let's make the things perfect so that we can understand what is been taught in 1797, which was how much it is right and perfect. Now world is doing that all today and saying they invented, but that's not true. How? Let's see. So what's my question for the all you guys? If two people are got exposed the same virus, why does the only one develop the chronic disease and another one is not going to get the disease? Any answer for it? Like one family member, two brothers are there. One got, both of them got the same viral infection, but one got the chronic disease but another is not having any disease symptom or sign. Why is it so? Any answer?
So susceptibility, people have cancer differently.
Correct. So
Nathan Sora has their susceptibility. Mostly people are
now, what is susceptibility? That I'll also explain through this point of view. And what is the answer for this? As per my understanding, I'll help you to understand. Infection, not even infection turn, and not every infection turn into the cancer. Why? Because that outcome is going to decide by the terrain itself. Means what is terrain? It's called as the internal environment of that person. First of all, understand what is terrain. It's an internal environment of that person. How? When that this terrain is healthy, this body clear that insult naturally. When if that terrain is got chronically altered, what will happen? Virus can persist silently. If means if it is a healthy terrain, the body will get healed and clear it silently. If it is the terrain is unhealthy, it will persist silently and it may show the chronic metabolic disorder like cancer in future. In terms of homeopathy, if we say what is that, that is what is explained in our miasm. Miasm itself not a disease, it's a soil which allow disease to grow. Today we are going to not only explore how the altered terrain enable the viral persistence, but also over the time how it causes serious pathology. That is how it is going on, the whole process we are going to understand from now. Now, very important thing is you'll ask, doctor, you are using this word terrain again and again. But what it means? It means entire internal environment where what happens is like how T cells, NK cells and macrophages respond, like which called as a immune system what we say. It include like metabolic health, means what? Insulin sensitivity, mitochondrial energy, even though how it reflect on the baseline inflammation or hormonal balances, even in the epigenetic setting that decide which gene stay active at this microbiome of the gut and mucosa. Even though in the psychological state like stress, grief or any resilience, disease does not arise from the one single factor, my dear doctors, alone, because it emerges when entire terrain shift out of balance. So what it means, what we say in homeopathy, we take the mind history, we take the past history, family history, personal history, any medical history, any other things which we feel that affected somewhere. What it says, this is what, like stress, whether it is a hormonal issue, whether it is a natural killer cells issue, whether it is inflammation or whether it is like the digestive system got impacted. This is what we understand from our history taking part. Now here you maybe get connect what is terrain and what is we are doing in homeopathic case taking. Now what is our master said? Our master says ki treat patient as a whole, not as a disease. Why? That is what, that's terrain where we need to understand. Like in healthy terrain, tissues are well oxygenated. Inflammation is in the inflammation is in the control state. Metabolism is in the balanced state. Immunity is in very competent way. So virus got cleared naturally. But when the terrain become the dysbiotic, what will happen? Resilience drop, oxygenation will get fall, inflammation become chronic, immune surveillance become weaker. In this environment, virus don't disappear, they hide persistent and reactivate over the time of period. Now, if we talk about the chronic viral presence, can it disturb the cellular regulation, pushing cells toward the dysfunction, even the mutation? Diseases, then it's not an invasion, it will be the failure of the terrain to maintain the order. Means in simple word, if the terrain is got disturbed, it have ability to disturb the whole system from start to end. Everything will get disrupted, and it may be presented as a complex disease in future. So this is what is called as a doctor's terrain. Now if you see the diagram in front of you, what you get to know from that, why I am given this example, so you guys can understand what I mean is, because now the HPV is a human papilloma virus is there. How it is coming, it comes to the, how it goes into drive and create a cancer. This is a flow chart, you just have a look into it. Only when the internal control system got fail, like after HPV enters into the cell, its DNA get integrate into the host genome. If it get integrated into the host genome, what will happen? That will disrupt the viral E2 gene, which normally keep a viral activity in check. So E2 is how much important? See, it is important to check the viral activity. But once E2 got lost, HPV will produce E6 and E7 proteins. And then E6 will inactivate P53, the cell, the DNA repair, and apoptosis guardian. While what the E7 disable, then PRB, the cell cycle break. With the both this safeguard will get removed, genomic instability will get developed, and over the time of period, the uncontrolled state can lead to the malignant transformation. Now here you guys, may you got the understanding, the people what we usually ask in cervical cancer or in the neck, people do have the that viral warts, and after certain time what we get to know, that person got affected with the cancer even though without bad habits. Here we can get the idea how HPV entered and how that whole terrain got disrupted, which the result what we got today is a like a malignant transformation. So this is doctor's terrain all about is. Now if we see the pathway, how the chronic stress causes, because what we understood, dear doctors, everybody in the modern science and everywhere talking about the stress, but how it is important and how it is affected that individual, nobody is explaining that mechanism. And if, as being doctors, it's really necessary us to understand that all, because then and then only we can understand the importance of it, and then only we can think how it is related with that whole process. For now, if we check about the interest, there are the stress. What kind of stress? It's a stress inside the cell can drive the cancer, like intracellular stress or the external insult that generate reactive oxygen species, which we call as a ROS. In the healthy system, antioxidant defense trigger DNA repair or apoptosis, where in the healthy system safely removing damaged cells. But when ROS, that is reactive oxygen species, get overwhelmed, these defenses, the damaged DNA, lipids, and protein that activate persistent inflammatory and stress signaling instead of resolution. Means what? Instead of repairing, that started getting inflamed, and instead of resolution, that started apoptosis, and that apoptosis got fail, mutation got accumulate over the time, unchecked damage and survival signal leads to mutagenesis, ultimately cancer. Again, it is not an insult alone, but the failure of regulation that create the disease. Means how stress is going to the play a role. That is again, it's not alone, but it has a role. Now, again, my question is to you guys. If the virus is no longer detectable, can it still influence the disease outcome? My question again, if virus is not longer detectable, can it still influence the disease outcome? What's your answer? What I mean is, we are not able to detect the virus, but
Yes, yes. The answer is yes.
answer is yes. So here you guys very right, because as I said, how it is right, let me explain properly to you. So that's actually called as a epigenetic. Now, first of all, let me give you the very clear idea. What is terrain? We understood. Terrain means if that body in homeopathic perspective, your vital force got deranged, then your body will become disease. Is called as a disturbed terrain. Now, same way, we will look about the how epigenetic work. Viruses don't always damage the cell by changing DNA sequence itself. What it says, virus don't always damage the cell. They are not only going to damage the cell by changing DNA sequence itself. Instead, what they will do, they will reprogram the gene expression through the epigenetic changes. Virus won't change the sequence itself, but they reprogram the expression through the epigenetic changes. This line is very important. Like how, what kind of epigenetic changes? They modify the histone, they altered the DNA methylation, can silently silence critical tumor suppressor gene. This shift how the cell behave without mutating it's a genetic code. The most important point is that epigenetic scars can persist long after the virus is clear. That is why you guys I ask you whether the virus is not there, so it is going to give an impact on human being. As you said, yes, you guys are right, because even though virus is gone, still it have the infection because it is going to cause epigenetic scar. Now how? The infection seems gone, but altered the cellular instruction remained, quietly increasing vulnerability to chronic disease and cancer. Now, so from after a discussion of all that stuff, what we get to know? We get to know epigenetic is they are going to impact how genes methylation process, histone and all, and that how it convert into the chronic disease or cancer. But if we look it through the homeopathic perspective, what how it will be explained? In our homeopathy, we always called a dynamic imprint, because our master says already Master Samuel Hahnemann, miasmatic memory. What it is, where the disease influence remain even after a original cause has disappeared. The body may look recovered, test may be showing normal, yet altered pattern function continues silently. This lingering information disturb regulation, weaken resilience, and set the stage for the future illness. Homeopathy aim not just to remove or trigger, but erase the dynamic imprint and restore the order to the vital force. That is why how much, see how terrain is given, what homeopathy says, what epigenetics in modern says, what homeopathy says, why we are discussing, because it is already been explained in 1790 by our own masters. Now, very important thing, how that all process happen. It's called as a malignant transformation, because in this in long-standing cellular disruption, when accumulated with the genetic mutation, combined with the persistent epigenetic changes, what kind of normal growth control is lost, cell begin to divide uncontrollably, even the invade the natural death, even though behave as if they are immortal. Means what? Body is not understanding what is happening with the system, and and that is not understanding to how to sustain. Then they stimulate the new blood vessels formation. See, if the once the epigenetic got involved, first of all terrain got disturbed, then epigenetic get involved, then what will happen? To then it will stimulate the new blood vessel formation, what we call as, it's called as angiogenesis, eventually acquire the ability to invade the surrounding tissue and spread it to the distant site, which called as a cancer. Therefore it's not a sudden event, but the final expression of the prolonged loss of regulation at the cellular and systemic level. How? That we will, by this stage where we get to know the virus itself may not longer detectable in the body, Because what happens now, we had checked like HPV, whether it is a torque test, whether it is a positive. If it is getting positive, IgG or IgM, then we check the viral load. Then we get to know the viral load is not showing, but it's already altered that epigenetics, right? So that is why we know कि virus is not no longer detectable, but that is there in the, but it already affected that body, and that damage has already been done. It's a genetic and epigenetic footprints remain embedded in the cells regulatory system. Like mutation persistent, tumor suppressors pathway stay silent, abnormal signaling continue. Even the virus is absent. This is why we call it a viral footprint in cancer. So once we understand the epigenetic and terrain, then we get to know how much viral footprint in cancer is important. The disease is no longer driven by the active infection, but the lasting imprint the virus left behind on the terrain and the genome. What we usually say, that copies are remaining, their duplicates are remaining, they are looking like that, but they are not the virus, and which actually doing that all the stuff, and body signaling is not showing any sign, is not defending, because that system is already not understanding whether it is came or not. Now, from the dynamic viewpoint, if we look at physical tumor is not beginning of the disease, it is a final visible expression of long standing internal disorder for a year. It's because we don't know now since how long it is there in the body, but for years subtle functioning disturbances accumulating the dynamic level, shaping the terrain, and even weakening the regulation. The gradual distortion in what homeopathy called as a chronic miasmatic process. When the body can no longer compensate, the disorder finally materialize as a structural reason, because body is not responding longer because it is not in the process to compensate. So tumor itself is a representing culmination, not the cause, but the end stage of prolonged dynamic imbalance. So here you doctors, you get to know how homeopathy is already explained that all. But what happens is what kind of interpretation and how interpretation we do, that is what is going to decide whether it is given in our science or not. This is my just little understanding, just I am sharing with you guys. Now let's proceed. Like if you ask me how doctor you say that give us some example. Here I'll give you the example. If you read, so here already given like HPV, HBV, HBV, EPV, EBV, EBV, HCV, and that HHV8. How these are the viruses, these are the example. If we look about their mechanism, you can see to it only EBV. If we look about the C. Mike evergreens, so this is what is the mechanism. Now if it is going to target on the where it is going to target, it is going to target on the oncogenetic activation. And if we look about the result where it is going, like it is generating the lymphoma like disease, means science is already proven that all. If you read guys all the viruses, their mechanism, their cellular target, and their result, you will yourself get to know how it is correlated. So this is how the viruses plays the role in the human system. So if we talk about the consequences, a terrain of susceptibility, as we discussed, as you also said, dear doctors, it's a susceptibility. Now it's my time to explain what is my understanding about it. So viral footprints changes the terrain of the host body. Host body means that person who is getting impacted. How? Genetically, epigenetically, and immunologically. The terrain determines whether one person clear infection easily while the another develop the chronic inflammation, which is usually we call as autoimmune or cancerous. This is the mirror of homeopathic concept, which we usually call as a miasmatic predisposition, like inherited or acquired susceptibility that shapes the disease expression. Like we usually ask, is there any history of cancer in the family? So that is what we ask. Is a miasmatic predisposition? If the person says no, there is nobody has, then what we say, do you get any infections? Then we check the torque 10 parameters. There we get to know whether these viruses are there. Are they showing the action on his body? Because in the modern, usually they say no reason. Another thing, before approaching, I just would like to say one line. Most of the time patient came, like if the young person got cancer and they came to us, what they say, doctor, I have checked that genetic testing done, but nothing is showing into it. But as I said earlier, they are not involving that DNA. They are making the DNA in a such a way that formation where the disease alteration is there, but genes DNA remain intact. They only change their expression. Now you guys tell me that test, what is the meaning of that test? Because it has not been designed designated explaining what actually happened. So that is why homeopathic history taking is how much important, and how we supposed to look it into is very important. Because as I said, in one person the infection got clear easily, but the other hand, the same family member got a severe autoimmune disease or cancer. So this is how. Now, very last, very sincere thing, viruses may die. We know all viruses are dead particles. But why I'm saying die? Because the echo keep whispering in our genes, because they are going to play a role once they entered in the body. If your terrain is good, you are the luckiest one. If the terrain is bad, then the virus will be the lucky one, I must say, because that have ability to keep whispering in our genes. So this is what my approach about the terrain and epigenetics. My dear doctors, today's our case is a breast adenocarcinoma. Hope you guys got the clear idea about the terrain and epigenetics, because I have tried my best to explain in a very simple language where we can get the idea, and not only for the terrain and that epigenetics, what is being told in the homeopathy about that terminology. As per my knowledge, I have just shared with you. So let's this case, the breast adenocarcinoma. This case was 38 years old female came to see us, but when she came, because she already did the before, see, you can see the case in front of you, but I would like to explain from my end. The patient comes because that was a post surgery case, and you know why she came to me? Because the after surgery na, that she got the surgery for the left sided breast, but she came to me for the pain in the right sided breast, and she was saying ki something I feel lump like, and that is why she came to see me. Then I asked first question, have you visited your old physician, then who did that surgery? Then told me, doctors, what's the point to visit to them? Why? Because they told me, get it operation done, have this medicine and all. But even though I'm feeling, because somewhere maybe my right side also got impacted, and I have that, she was got in scared, like she's in very stress. So then I understand what's the purpose she came to see me. Now, what was the symptoms? Like loss of appetite, severe insomnia, because lot of stress, fatigue, worse in the morning. And what she was actually told me, doctor, that chemotherapy I took before was very disastrous for me, because was in the phase I'll not survive. So I do not wanted to go for it. That was her talk. Now patient advised PET scan, but you know something, we usually say to get the test done, but that's not always comfortable to the patient. Why? Because they're in the scared state and they do not want it to see what is actually is happening inside. They just want a solution that you need to provide with confidence. Okay. Now If you see the family history, mother died also from the breast cancer, recurrent cold and tonsillitis, even though her tonsils got removed at the age of 26. Since then, she told, "Ki doctor, after 26 now my health is on and off is going on. Sometimes I feel irritation, soreness in the throat, loneliness, anxiety about health," because she was very sensitive kind of mindset lady. Okay, now if we look at all about is, so here what is an important, now we'll understand the concept of terrain and epigenetics side by side, so that you'll also understand whether what is being told by myself whether I'm using it in the practice or not. So here is, if we look the symptoms like anxiety about health, tonsils got removed, lymphatic barrier got lost. What is the tonsils plays the role that actually block the viral infection or any bacterial infection to goes inside, and they act as a barrier. But that barrier got lost. Then what will happen? It will the deeper the susceptibility and viral persistent, which is actually called as a psychotic terrain. In the at the end, it will be called as a cancerous diathesis. Now, if we if we look at into how the theory and how the practice is, you know, like we can breach or we can understand how it is correlated, because removing the tonsil eliminate what will happen, the primary lymphatic barrier got removed. Then what happened, the pathogen who was going to get filtered and entering into the mouth and throat, that barrier is not there, so they are definitely going to go inside, because barrier is already lost, right? Now what happens is that system becomes more vulnerable or deeper level, allowing viral persistence within the tissue, because that is already going to enter. Now what will happen is, over the time of period, that contribute to the psychotic terrain, making what will make, it will make a congestion, it will make a chronic inflammation, it will suppress elimination. Means there is no barrier, like on border of our country, if there is no military or no fencing, anybody can come and go. Likewise, they are entering into the body. What will happen? The cellular regulation got weakened and risk of malignant changes will get increased. And the same happened with this case, because the tonsil got removed, that was the history, and strengthening the terrain therefore becomes an essential. That is why terrain is important, why strengthening terrain is important is for that purpose only. If the terrain is healthy, means the person will remain healthy. But if that kind of tonsils and all got removed, the body itself will get weak, because terrain will get deranged, right? Now the patient symptoms, as I already you can see, weakness, tiredness, sensitive to cold air, craving warm drink. Mental symptoms we check. Why hydrostasis has been chosen? It is a first of all anti-cancerous activity is there. Second thing, it have a very strong activity on the lymphatic system of the human body. And third thing, it is working for the that is a anti immunomodulation, have an ability, that is why hydrostasis Q is given. Next, after follow-up, you can see the 10% change in the swelling. Appetite also got improved. But here you can see Baratakab is already given. But the mother tincture got shifted to Leppa major. Now why? If you check now, the Leppa major, if you'll get to know it have an action which reduce the viability and proliferation of human breast cancer cell lines, extract disrupt the metastatic cascade by inhibiting cancer cell migration, invasion and colonization and apoptosis. So as I said, every time I see the condition, on that basis I see to it ki what kind of mother tincture is given, because as I on the very first session I told you guys ki like first of all constitutional, second is about the miasmatic and intercurrent, and even the organ supportive remedy, how I make the four that how I make my prescription. Now here Califos 6x 2 pills given. Why? It supports the cellular vitality, especially in the long-standing illness. As I said, stress is also one of the cause, which is really important. That is why Califos is also important to get down that cortisol level in the body of that person. Now in the second follow-up, patient says, doctor, bit much bit better. I feel something is changing, my size is changing, but they said my weight is also gained by 1 kg. See, whenever we treat a patient, definitely medicine is going to the body, they will definitely going to show some sign. But while talking, we always keep in mind what kind of behavior was before and what kind of behavior is today, because that is the only expression of that person which help us to understand whether they are going right or wrong. No doubt we'll ask the question, because but many patients without asking question their body language itself explain. Now next, here confidence also got better. Patients is pain is bit better, doctor. Okay. Now here I given Baratacab 1 m weekly and carcinosin 1 m 8 pills once in a 15 days. See, Baratacab is constitutional, but why I need to give like in 200 per day or 1 m weekly? This is very important because that terrain we need to get balance, because only give medicine it will get trigger and again will not give, it won't happen. That because that is my experience I'm sharing with you. So now in this time I changed to the Actia racemosa. Why Actia racemosa? Because its effect on the breast cancer is anti-cancerous property, and even though it is helping to stop the recurrence, means that metabolic process can be stopped. Now it compound is inhibiting cancer cell growth, and very important is estrogen production. What is estrogen? If you check, dear doctors, in modern science usually given the estrogen suppressor drug. Why? Because estrogen is a precursor which can trigger the metastasis in the breast cancer cases, or mostly in the case of post surgical cases. That is why they usually say if you have the breast cancer, at least remove the ovary, or they will suggest कि better you take the medicine as a estrogen suppressor. This is, you can also Google it, you will also get to know what I mean is. But that property is there with the Actia racemosa, that is why it has been chosen. Now, that is going to potential for reducing menopausal symptom in cancer, possibly activation of serotonin receptor rather than the acting like a estrogen. This is a purely clinically, this is proven what I am saying all about of the Actia racemosa. Now here we gave Calcarea for 6x, that is only purpose of support that osseous nutrition and marrow vitality. Now in the third follow-up patient visited, patient said, doctor, lump is much better. I'm feeling quite better. I can say that yes, your medicines are helping. That was the word. I always remember ki what astonishing action and reaction is that time patient is giving to me, because I always try to see to it how their body language comes, how they enter, what they do, because that is very much helpful to being as a physician to treat them well. Now we again ask, as we see, we always see the things clinically. We ask them, get the PET scan done. Again she said, doctor, you know me now, so I'm a bit scary. Okay, what we can say. Now here we gave allium sativa Q. Now why? Because if you see na, it inhibit the proliferation of breast cancer cell like MCF7 and MDB MB231. What it is? It suppress activity of estrogen level and induce apoptosis. This level is there with the allium sativa. Because if you see na, most of the patients says, I went to the Ayurvedic doctor, they said me to have the lasun every day, so it will be helpful. Likewise, why they saying? Because they have that kind of properties, right? But now here we have the homeopathy like tincture, so we can use it. Here we give the Silicea 6X. Why Silicea 6X? Because nodules are firm, deep seated, and healing is slower after surgery. Because already they gone for all that stuff, but the healing is still in the process. Then the scar tissue remains sensitive and unhealthy. The remedy is Silicea. But here we need a specific action on that area, so we are using 6X Silicea for that purpose, right? Now, fourth follow-up. Lump is going well, patient already gained 2.5 kg. Bone pain, patient says, doctor, I'm feeling better than the first day. Because I usually ask the question, I first of all I ask the when you visited that time how it was and how it is today. If you guys ask na how it was on the last time and how it is today, then they will get confused and they will say, no, I don't feel any change. We supposed to ask how it was on the first day and how it is today, because we are taking that thought while treating, so we should keep that focus. Why that is also called as a one terrain and epigenetics we are keeping into the calculation. Here we give the mentha piperita. Why? It has anti-cancerous properties against breast cancer cells specifically, but for this time we didn't change the silicia because we want that more healing, because the patient is saying lump is reduced but that is still there and the scar is feeling less painful, means that is pain is there, right? Now after fifth follow-up, so the mother tincture, here we gave the scrofulori acue. I think so we are about to 5 7 minutes are there, so allow me to make it fast. Hope you understand guys, right? So the scrofulori acue is been given. Why? Because the background is chronic inflammation, lymphatic congestion, impaired drainage, and tissue breakdown. That is what the important parameter. Here we gave the calcarea for 6/6. In the next follow-up, patient is improving well. Here tincture is being given as a rosemary. Why rosemary? You Google it, you'll get to know it's a very great best medicine for the anti-tumor property in breast cancer, including it have ability to inhibit the cancer cell proliferation, induce apoptosis. That is what is apoptosis. It's called as a programmed cell death. Means what? We give medicine and we get to know yes they are doing that work well. Here again we gave the Califos because meanwhile we also need to judge the mind level of that patient. Somewhere if it is we feel like a confidence somewhere up down, so I have changed to the Califos. In the seventh follow-up, if we check things are going well, here Baratagap 10 m, carcinosis 50 m, one dose in a month. Here drug is given Sionathascu. My dear doctors, Sionathas, the medicine which I found is really great because spleen is also the lymphatic organ and it has a great role in the cancer stages because there is a lymphatic congestion, splenic overload, which weaken the immune filtration and even of abnormal cells. Sivanathas reduce the congestion, support to detox capacity and improve anemia and tone of the spleen. That is called as a making it a key terrain because यही है उसको repair करने के लिए. Now here we give the calcarea for 3x. In the eighth follow-up, patient says, doctor, somewhere I feel confident and I'm feeling much better. The wording was so soothing for me also. Yes, if we follow the track well, we can give that outcome to that patient. Because cancer, most of the time patient says, means I am not going to survive. In that kind of cases, if we provide a good treatment, that is really appreciating for their betterment and for our confidence too. Now here we gave Kurukim, that is Curcuma longa, 10 drops because it is again anti-proliferative and apoptosis inducing effect in the breast cancer cell. In the ninth follow-up, patient says, doctor is much better, I can't feel anything now. I can sleep, my energy is okay. Then here we gave the Camellia sinensis because it's an again antioxidant, anti-inflammatory property, inhibit that this breast cancer cells, even the proliferation. In the 10th follow-up, patient says, much more better, and the patient brought me a gift that, doctor, because of you I am feeling much better. That is why I remember this patient said ki doctor, make me scared ki you'll not survive longer, but I can see the hope. Here we give the tinospora, which for the immunomodulation, anti-inflammation and terrain remedy. Now, dear doctors, I would like to tell you something. Ki, here the case ends. First of all, patient got improved, terrain got balanced, epigenetically patient see improvement. Now, if we see the any other medicine we can think of, yes, compound like bufo we can think of, because if you check the research paper about the bufo, you'll get to know it has a proliferation inhibition of proliferation of human breast cancer cells, aggressive type like a triple negative breast cancer cells, by inducing cell cycle arrest and apoptosis, reduce metastasis. So bufo has a role. Second, as we know, Asteria rubens. Asteria rubens, but if you see Asteria rubens, again there is a research available. There you can understand how much it is important, how it plays the role. Merck Sol. Merck Sol is why important. Merck Sol have an ability to damage DNA by causing disrupting the DNA repair mechanism. So, so mercury has a very good role. Now, if you see uh, about the final outcome of the case, the weakness, appetite, sleep, mood, bone pain, cold, wet, everything we can see the good improvement. Now, the basic point is how we calculate this. Disrupted, because it's a tonsillar viral terrain, right? See, past history and medical history, why it is important, because disrupted immune barrier plus chronic suppression is at actual called as a psychosyphilitic breakdown, which called as a cancer diathesis, and breast cancer, which that diathesis convert into the breast cancer and bone metastasis. Now, question you guys, how many of you think that lymphatic system as a drainage system rather than the active immune organ? Hello?
Waiting for the comment.
Yes. How many of you think of the lymphatic system as a drainage system rather than the active immune organ?
I think so the question was not clear.
How many of you think that lymphatic system as a drainage system rather than the active immune organ? So,
So the question is that how many of you think that lymphatic is a the first comment came up, active immune organ. The lymphatic is the active immune organ.
hmm,
One of the answer is drainage system. So active immune organ, immune organ. Okay. Most of
okay,
the population is answering in that. Okay, one of the answer is drainage system as well as immune organ.
perfect.
Okay,
Now,
good evening.
here I'll try to explain what is my finding. So, how the constitutional, in this case, now we can take the example of this case only. Ki constitutional susceptibility and terrain alteration got coverage over the time, right? Patient has a strong familial predisposition to the breast cancer along with long-standing health-related anxiety. Okay, so both the indicator what it says, it's an inherited and acquired. Both the things are there, in and which actually affected their internal environment, right? So now, early removing of tonsils represented primarily lymphatic and immune barrier. Tonsils are not merely local tissue, they are part of the mucosa associated with the lymphoid system, playing a very key role for the immune education, pathogen surveillance. Their removal reduce the local immune filtrating and altering the lymphatic signaling, right? Now, if we talk about the terrain based viewpoint, like barrier loss, allow the deeper penetration, persistence of microbial viral influence, and which what it cause? It cause subclinical production of chronic immune stimulation, low grade inflammation and immune tolerance. So in this model, cancer is not caused by the single infection or surgery, but represent the late structural expression of prolonged lymphatic, immune, and regulatory symptoms. So another question is, what happen in your view when the body waste clearance system slows down for years? Like as I said, it's a what is a cleaning symptom system is our lymphatic system. If the body waste clearance system got slowed down for years, what will happen?
So the we are waiting for the answer. So I will just continue. So it will accumulate and it will disturb the dam. So with waste will accumulate and it will weaken the inflammation. It will create inflammation and rearrange the dam.
So in my clinical experience over the years, what I came to know that I'll share with you guys, lymphatic system is a most vital defense system of our body. If you ask why, answer is very simple, because lymphatic system where the body fights and clear the threats. It is responsible for immune surveillance, waste removal, and regulation of inflammation. However, in modern living places, continuous burden on the system, like chronic stress, environmental toxins, poor dietary habit, sedentary lifestyle, prolonged sitting, lack of physical movement, all slows the lymphatic flow. When the lymphatic system becomes sluggish, cellular waste and inflammatory mediators are not efficiently got clear. What will happen then? This will lead persistent low grade inflammation at the tissue level. As we already understand, chronic inflammation is not a benign. It alters the cellular signaling, disrupt the immunity, and over the time it creates the biological environment that favor the chronic disease, including malignancy. So therefore, protecting lymphatic health is not an optional, it's a foundational to the long-term resilience and the disease prevention. What is the purpose of asking you guys this question? Because most of the time the lymphatic system is a ignore system. I have seen many times whenever I am talking with the many doctors now, there I understood they are not thinking about the lymphatic system. That is why I just ask you this question. So anything now?
So one of the question of that, one of the major question, just
Some
I'm ending this session with one of the major question that doctor has asked. Like today, no one is saved of viral infection since childhood. Does that mean all of us is susceptible to get cancer if the terrain is rearranged?
very nice question. Here, what I would like to say is, as I given in a very first question, if the two people is going to get infection of viral infection, one is getting impacted but another is not getting, that is what it is called as a terrain, which is very strong, who has a very great vital force, they can only survive well. Now that is why if we look at today, my dear doctors, many more cancerous cases are coming up in the market. Like small kids are also having cancer. Even the person is very young, very dynamic, doing everyday exercise, still they are getting cancer. Why? Because their immune system is not working well. We always listen from every doctor, every patient, my immune is weak, my immune is weak. But we are not getting what actually the scenario is going on. That is why what is important, don't treat the organ, don't treat the disease, don't treat the condition, treat the system, and treat the system. Even though what is important, like terrain clearance is very important. If we make the terrain healthy, we can help that patient to survive positively without disease. That is why nowadays what happens, something is happened taking antacid, if having headache taking painkillers, not feeling well, taking antibiotics by their own counter prescription. And what is affecting, they are getting affected with that inflammation and that all the stuff. And what is happening, I have seen one of the case, like the patient is saying, my doctor told me I have a viral infection, so they given me the antibiotic. Now let me ask you, dear doctors, ki, if the viral infection is there, then what is to be prescribed? Antiviral at least. But here for virus it is prescribed like antibiotics. The biotics, as per my knowledge is concerned, it is looking like ki somewhere they are looking for the bacteria. So somewhere that over drugging, lifestyle issues, and even though the family scenario, hereditary causes, along with that their working style, whole is getting impacted. So very important is to have healthy lifestyle. If we really wish to keep ourselves very healthy and perfect, what we need to do, we need to do the regular exercise, we need to eat more fruit, more salad, need to eat before sunset, need to do the regular exercise, we need to have good hobbies like listening music, playing music, going for the ride, or give time to your own health. But what is happening, everybody is there in rush, and that is why the terrain and epigenetics are getting changed. What I mean is, I-
Wonderfully said. Uh,
yes. So what I mean is, we all are the doctors. We are also dedicated doctors. We also sit hours together. We also now need to say, I'll also give time to my own. At least half hour or 1 hour in the morning and 1 hour in the evening. Give time to your own health, because you are also the individual and you also deserve the good health. So to helping other is really important, to make, but make ourselves healthy is also important. If you really ask me, doctors, I'm telling you, I have every day half kg fruit, half kg salad. I usually walk 8 kilometers in a day. I ate my lunch at 10:30. I ate my dinner at 5:30. I came to 11 o'clock at my clinic. I leave at clinic by 3 o'clock. Whenever I reach at home, I have the half kg salad in the afternoon. 4 o'clock, 5:30, I have my green vegetable soup and bakari crush, and I eat. And I came to clinic at 6 o'clock. I'll be here till 8:30, 9 o'clock. Once I reach at home, I have a cup of milk. This is what my I'm following my lifestyle, and the same way I'm telling to my each and every patient, and you guys believe me, is really helping. That is what I said. First of all, if we wish to treat someone, we should treat the person like his lifestyle, how it should be, what kind of care he's supposed to be taken, what kind of mindset he's supposed to keep, and how he can care himself along with the others. And I usually say, always visit a physician who understand you as a person, because if you are able to get understand by the next person, then and then only you can able to get that result what you are expecting. Or else most of the time what happens nowadays, patient coming as a customer, a doctor treating as a shopkeeper. It's in the other sciences I'm talking about, I'm not talking about the homeopathy. Even though I'm not blaming any physician, everybody has their own approach, but our master says we are treating person as an individual. And before saying goodbye, I just wanted to say one thing about the cancer, and about the miasm, from where I get more confidence. If you read a symphony written by our respected Dr. Biju sir, in the third section, like what we see to it, like page number 293, where Dr. Our Biju sir said how it is miasm need to be used in a clinical practice, which remedies are having, like they mostly cover more than 400 remedies which are being used in regular practice. Even though how to check with history, like they gave Sattvic, Rajas and Tamas protocol also. And there I get complete detail idea about the miasm, how we can use while doing this practice. But dear respected doctors, I think so. Everybody has our doctor's book, Biju sir book, but that need to be read every 2 to 3 month, so that we can understand more deeply, so that we can get to know, acha, this is the meaning when it is to be used. So this is my humble request to you all, कि our Biju's book is really helpful, because as I said on the very first session also, I am inspired by our Dr. Biju sir, and I'm really taking very nice learning from Sakya group also. I'm a regular visitor with that group, and I really feel happy to meet you guys, because I once, whenever I talk with you, I feel yes, I'm talking with my family physician, my friends, so that this is what the bonding with Sakia and you guys. And I really appreciate for giving this opportunity to me. I really thank you, Sakia team and you guys. Now, just a last quick question. Now, do you feel so? Hello? Do you feel so?
Yeah, yeah.
YouTube channel. I want to review this. So now, very important thing I would like to say, कि if somebody is feeling that कि need to listen this session again, you can revisit our channel, Dr. Shailesh Sancheti Advanced Homeopathic Clinic. This first session and the second session already recorded and put it on our YouTube. It may be today's session available in tomorrow or day after tomorrow, as by the YouTube protocol. But yes, you can also listen over there. If any queries, please feel free to ask us. And very last thing I would like to ask you is, do you guys wish that need another session with something extraordinary?
I think so. There's a good answer of yes. So based on the time currently 9:18. So
Yes,
I think so. Many people are asking yes, and we will discuss with the coordinators and Dr. Biju and Dr. Shailesh to set up a session in near future.
yes.
So
Thank you so much for giving me this today's opportunity.
it was a
Thank you.
wonderful session, wonderful diving into getting into what your lifestyle will do to your body and how you have to think by yourself and your patient side also. And each of the thing was explained wonderfully. So thank you, Dr. Shailesh. Thank you for the wonderful session. I will just, if there is any query, I will just ping you again and I will disturb you again with the doubts that has been discussed. So thank you everyone for attending this and thank you Satya for hosting this wonderful event. So thank you sir. Finally, it was a wonderful session. Lot of new things, lot of things have been cleared out. I think so. So so we are just signing off and we will let you know if any session will be coming up and we will inform the participants output as well to you as well.
Of course. Thank you.